Time no see.
That's right.
All right. Doc, you stay up just after with us.
Sorry.
Everybody ready?
Everybody's ready to go? All right. Well, good afternoon. I'm Sheriff Mike Williams, and I'm joined today here by Sheriff Bill Leeper from Nassau County, as well as Dr. Kelly Wells from the Duval County Health Department. And I appreciate the media coming out today, especially as we head into the weekend. Hopefully the coverage of the story will be seen by many people in the region. Sheriff Leeper and I are seeing a dramatic increase in drug-related deaths due to heroin here on the First Coast. In 2015, we had 45 deaths due to heroin or involving heroin. In 2014, that number was 17%. So that's a 265% increase in 1 year. With that, I'll turn it over to Bill and let him talk briefly about his numbers. Bill?
Thank you. Prior to this year, we did not see any heroin-related deaths in Nassau County. Over the last 2 weeks, or since February the 17th, we've investigated 3 possible heroin-related deaths, one in Fernandina, one in Callahan, and one in Hilliard. We also investigated 2 possible heroin overdoses resulting in near death, and both of those were in Callahan. So we've seen a dramatic increase here recently, and that's the reason why we're here today.
And we also have, we talked to Sheriff Beasler. He couldn't be here with us today, but I know his office has numbers that are available too in terms of the increase in activity. We understand what's going on out there on the street and in the drug culture, and we want to make everybody aware. You know, with the closure of the pill mills years ago, you have a group of people, a population addicted to opiate-based drugs. When we closed the pill mills, obviously, we dried up that supply. It significantly dried up. Heroin, up to this date, has replaced that, apparently, as we move forward. So heroin as an injected drug can be cut with anything and sold as really a great high or a higher high. But the truth is overdosing can occur more easily because of that. As the drugs build up in somebody's system, it may take more of the drug, obviously, to get them to achieve the same high that they had once before. But in doing that, they obviously are ingesting more, and the toxicity of heroin is a lot different than other drugs. And obviously you are really on a path to certain death as you continue to do that. Some of these deaths are from multi-tox deaths, so there's more than one drug in the system, and they're combining heroin with other street drugs, again, to try to get that high. I can also tell you that more people are coming to our jail with at least one heroin-related offense. In 2014, we had 77 people in jail, really from that offense. In 2015, that number grew to 117, and so far we had 19 people admitted into the jail on a heroin-related offense just in this year. But of course, we're not doctors, but we have one here with us today. But as law enforcement, we know this: if a drug addict needs help, they will find a new drug, including committing crimes very often to obtain these drugs. So the smartest thing I can tell people to do is to not go down that road of injecting heroin. I can tell you the message today from us in law enforcement is simply this: heroin is not a recreational drug and should not be obviously used as such. It is illegal, obviously, and we want people to stay away from that. Secondly, if someone watching this broadcast has a loved one who's addicted to heroin or an opiate, they should reach out and get help, and we're going to talk more about that in just a minute. Again, the dangers of this drug are widely seen, and we're seeing evidence of that here, obviously, in our community now. So with that, I'm going to toss it over to Dr. Wells and get her to really discuss what someone can do, if they have this tragic issue in their family. Dr. Wells?
Thank you, Sheriff. The Florida Department of Health in Duval County is partnering with JSO to remind the public about the dangers of heroin abuse. Injectable drug use is a public health issue, not only because it hurts the individual abuser, but because it hurts family and loved ones and can potentiate other health problems, including spread of infectious disease. Illegal drug use kills more people in the United States than traffic deaths each year. As opiate abuse and dependence has increased, so have heroin-related overdoses. We find now that heroin is easier to obtain than the prescription drugs that many were addicted to. There is a prescription drug and heroin task force that has been facilitated here in Duval County by Drug Free Duval that includes a broad gathering of Jacksonville community members, including law enforcement, school districts, business community, faith-based communities, government agencies, parents, and youth. And they're completing a comprehensive community action plan, which is what it's going to take in order to combat this. JSO has a free, no questions asked drug drop box at headquarters where anyone can drop off unused drugs. And those who are seeking help, there are a number of resources at your disposal. The very first I would say is if you or a loved one have an issue with opioid dependence or addiction, contact your primary medical provider. Every provider in our community is aware of the steep rise that we're seeing in opioid abuse and overdose. It is the language, it's the conversation of the medical community today, and every provider has the skill set necessary to get you referred and linked in for proper services, not just for substance abuse treatment, but also measures to protect yourself from the risk of overdose until you can successfully complete a program. There's a help desk you can call. The 1-800 number is 1-800-662-HELP. You may also call the Florida Poison Control Center. It's staffed 24 hours a day by medical personnel, and that's 1-800-222-1222. More than anything, I implore you, as loved ones, as members of this community, and perhaps even those of you who may have drug problems yourself, reach out for assistance immediately so that we might help you change the direction. The numbers that we're seeing without a community-based intervention and without raising awareness of those that are using, we expect these numbers to climb. So it is critical at this point that as members of the public health community, we make sure that everyone is aware and that everyone can avail themselves of the help that is within their reach. Again, 1-800-662-HELP. Thank you.
Questions for the sheriffs or Dr.?
Is there any similarities in the victims of these? I mean, the deaths,
No, I mean, nothing that really stands out to us. I mean, I think the one underlying factor here is the obviously the use of the heroin. And it's something that we haven't seen around here in many years. So obviously a drug that was very popular in the 70s. It had a brief reemergence in the 90s, but we are clearly seeing a reemergence of heroin, in really the country, but especially here in Florida. So,
Sheriff Lee, for the ones in Nassau County, they were much together. Did it have anything to do with the quality of the type of drug, or the strength of the drug, or the quality of the drug?
We believe they're being mixed with something that's making them a little more dangerous. But our message is pretty simple. If you're a drug dealer, we're coming after you. If you're a drug addict, we want you to know there are some dangerous drugs on our street right now. And the next 911 call we get could be a result of your death. So if you want to get help, if you want to get off these drugs and live a clean and sober life, then call us. We'll get you in touch with individuals or organizations that can help you. But you sincerely need to want to get help.
to Sheriff Leeper's point, we've seen a steady increase over the last couple of years in activity and seizures. In 2013, we had 99 heroin-related arrests. We seized just over 500 grams of heroin. In 2014, that number jumped to 246 arrests, seizing about 1,380 grams of heroin, roughly. Last year, 472 incidents of seizure with 1,471 grams. And this year already, we're at 72 incidents of seizures with 450 grams. So we are on pace to eclipse last year's numbers again. So obviously it's something from an enforcement standpoint we are dialed into and focused on as well. So.
Is there a rise in like hepatitis and things, Dr. Fans, hepatitis and all intravenous related drugs?
We're not seeing that in our local community as of yet. But as a public health officer, we're certainly tracking that across the nation, and there are a number of communities that have seen exactly that. Epidemics, in fact, of hepatitis, HIV, things that can be spread with the use of injectable drugs. Absolutely. And we are working to try to mitigate that. You know, we don't want that to be the case here.
With this rise, is it this that heroin's cheaper, easier option at this point? Is that kind of what you guys are seeing out there? For you or for the
In a community, when you have a population that may be addicted to prescription drugs and then you make prescription drugs unavailable, now prescription drugs are more expensive than cheaper opioid-based products. So that's exactly the correlation that's made, which is exactly the reason the community has got to step up and, along with enforcement, begin to offer other avenues for treatment in order to prevent this.
So off of that, just we're cracking down on the pills. What do you guys as law enforcement see as the next step then to combat this, I guess, result of that crackdown?
Right. I think it's the same. I think obviously it's the same at the street level. Obviously, working the street corners, making sure that we're putting the time and effort into that, and then working some longer term, mid-level and major case operations. Most of the heroin that we see coming into Florida is coming from Mexico. So typically, it's 1 or 2 steps out of Mexico and then into Jacksonville. So we work every day with DEA and are partnered on that task force and partner with HIDA and with Bill's people on HIDA as well, and working on those. The supply chains, if you will. So you work it at a lot of different levels, but obviously it's a focus of ours moving forward.
Sheriff Lieber, do you have numbers for arrests?
Prior to last few weeks, we have not seen a lot of heroin up in Nassau County. We did make 1 arrest last year, but it's something that's really concerning us now because we've seen it coming in our community, and this is something we're going to focus on. Right.
Do you see any on the highway out there? Do you get any traffickers coming through anymore like they used to?
It's out there. We do highway drug interdiction with other agencies as well, so it's out there. It's just incumbent on us to find it.
Good deal. Well, so to close, again, the message today is obviously for people watching the broadcast. Heroin, again, is not a recreational drug. It can lead to your death. And if you have a heroin addiction or an opiate-based addiction, please reach out and get some help. So with that, thank you all for coming today. Doctor, thank you so much. I appreciate it. Sheriff Lieber, thank you. Thank you. Take care.